We've decided to bring her to the studio so that she can talk about breast cancer awareness and her foundation. Good afternoon to you.
Good afternoon, Glenn, and good afternoon to the listeners at home.
Unjani?
Siyaphila njani?
Alright.
Kakhulu.
Lesisaba phela uzothi ukhozi unamaphiko kuphela. Hayibo, akeke kanjani? 2000 la. Why are you laughing? So fortunately you told me no, I'm with it. I know it's 2000. Yeah. It's not gonna accept uphumelele la simthembi ke uphumelele then. You might end up saying that. Welcome to the show, and obviously breast cancer is very dangerous disease. A lot of people don't know much about it. A lot of people don't talk about it. And a lot of people are scared to check themselves and are even scared to go to a doctor to get a proper checkup, because we're always scared of the bad news. But like they say, prevention is always better than cure. It's better to know during the early stages of cancer so that, you give yourself a chance to survive.
Yes. Couldn't agree with you more, Glenn, because I think in our country, basically, our women they fear rejection than death, which is the saddest part.
Yeah. So, talk to us about the work done by the Tobeka Madiba Zuma Foundation. What's the role of the foundation, and why did you decide to focus on breast cancer?
I think for me, Glenn, as much as my background is finance, having studied the BCom degree,
yes,
I realized that in our country, for our country to move forward, as a developing country, and for it to grow, it needs a healthy workforce. And without a healthy workforce, you wouldn't be able to achieve economic growth that is desired by the country to take us to a level whereby, we can be considered as a developed country. So it was important that one looks at what are the issues that are really affecting our people, why are they dying, and why also are they staying at home sick. And I looked at the disease burden, facing our country. And I think for me, this disease in particular, as you say, that it's still taboo to this end, which I was hoping it wouldn't.
Yeah.
I felt it was important that one gives it the face. And I think at the time, which was 2009, having found myself in a position of being the first lady of the country, I had to then say what it is that I wanted to do, what was my passion, and I chose health. And in particular to say, gone are the times when women are now going to be at the bottom of the priorities.
Yes.
Let's take our women's health to the top of the agenda of the heads of state and ensure that, the issues that are affecting them, and their health are given the priority that it deserves, because we agree sitting here that you're all born by women and mothers, and they are cornerstones of their homes. And it was important for me then to choose this path to say, let me start a foundation. And I think the reason why I started a foundation was I was looking beyond just the term of the president at that time. He was the head of state, and I thought to myself, then we must start something which is going to only last, for the term of office. Let me start the foundation so that even beyond his term of office, I could still do this work, which is what I'm doing now. And I then started the foundation, which is strong on advocacy, raising awareness, educating our communities, paying particular focus in the rural communities, because that's where, there's very limited access to information, to education, to people being aware about these diseases, and it's still, as you said, taboo to talk about them. And especially, diseases like cancer, they equated to witchcraft. So it was important for us to take it to the rural communities to educate our women about these diseases, but not only our women, their families as well. Because it's very important that we educate the families so that they can provide the necessary support.
So I'm sure when you were the first lady, obviously, you were not able to focus on your foundation 100%. I take it now.
Yes.
You have ample time to focus on it. You're able to travel, and obviously it's not easy traveling in rural areas, and obviously you also need to work with people. Do you have an office? Where are you based?
We're based in Durban, but we cover the entire country. We don't limit ourselves to our base, which is Durban, primarily Durban. And as you correctly put it, yes, before, my responsibilities, or rather my, I had to divide myself between the official spousal duties as well as, the foundation. And what had to be my primary focus then was the official duties, that when duty calls, you have to avail yourself, and the foundation then became secondary. But now, one has ample time to look at even those things that one could not do at the time. And I think I'm quite happy with the fact that now, all my attention is devoted to the work, and it's my passion. It's what I love doing.
And we know that you're doing this obviously from the bottom of your heart, but obviously to run something like this costs a lot of money.
It does.
People don't care whether, you're helping the community. You're also helping the country in a sense that it also affects the economy of the country when people don't go to work.
Absolutely.
Do you know? Most homes in South Africa are headed by women, and women are very important. So how do you survive? Do you pay salaries? Do you have people who work for you?
Yes, Glenn. I think for me, for most NPOs and NGOs in the space, the biggest challenge has been the resources to implement and roll out all these amazing programs that we have. Funding has been limited, and also just been channeled to fighting infectious diseases, your HIV, AIDS, and TB control in our country. Not so much the non-communicable diseases, but I think the tide turned when we attended the General Assembly in New York, when the heads of state said, let's stop, let's look at the non-communicable diseases. And I think for me, having belonged to the Forum of African First Ladies Against Breast and Cervical Cancer, then it was the biggest, I think, achievement for us to say, our proximity to power and to our husbands as the head of state, we could advocate at home. We didn't need to make appointments with them, and we were able to, we were successful in ensuring that it gets the attention it deserves, because the non-communicable diseases are diseases that didn't get that attention. And I think at that highest level, anything that gets the political will or support, it's likely to succeed. Because when they then looked at the non-communicable disease, they committed to say that when they departed from New York and got to their respective countries, they were now going to ensure that the non-communicable diseases are also at the top of the agenda. And also what of significance was that a holistic approach was necessary, that no disease should be looked at in isolation of the other. And that was important, that the very same approach that was used to deal and respond to the challenge which was posed by HIV/AIDS to stop it from becoming a public health threat should now be devoted to fight also the non-communicable diseases. Because when you look at the amount of money spent by our government in terms of the budget to deal and respond, only being reactive and not being proactive, was so huge that it now is exceeding even the HIV/AIDS.
So the most of the funding for NGOs comes from a lot of American billionaires, the American government. Obviously, there's a guy called Trump who's always threatening people that he'll cut funding. Is his presence making it difficult for people to get funding? Because he's always threatening to cut funding every day. I'll cut funding.
I suppose for me, I don't really think that the funding only comes from America. Funding comes from all the countries, from Switzerland, wherever.
Sweden, yeah.
Yes, it comes from Europe. It comes from everywhere. And I think America is just part of, and we've never really focused on getting funding from there. It has mainly been philanthropic, people that believe in this cause. And every second person that you talk to, Glenn, you find that they've been touched by this disease directly or indirectly. And so therefore you would get those individuals that are willing to support the cause, and you'd be lucky if you get big funding, but we haven't been that fortunate, I must say. And that is an inhibiting factor, to as I said before, to roll out these amazing programs that we have.
Okay, excellent. And what are the future plans for your foundation?
The future plans is really to continue to look at the gaps that exist in our healthcare system. And I think for me, one of them is the retraining of our health workers.
Okay.
And we've drawn lessons from how countries like Cuba have managed to actually, reduce the incidence of HIV to something like 1%, which is insignificant. And I looked at that model and I said to myself, okay, how did they make it? And it was easy and it was simple. It's within our reach, and that's healthcare workers that would profile each community and each household, to look at the disease burden facing that particular household and ensure that while they create education, they also profile that family to know who has chronic illness, and also in terms of screening, scaling up screening. So healthcare workers have been in the answer for Cuba, but also, we would meet annually and exchange expertise and lessons learned, and come back, tailor make them to suit our own respective countries, and not really say, I'm going to take as is and apply it in my country, because each country is different and the burden of disease is also different for each country.
Yeah, and I think, speaking about health workers, personality is also important. You hear stories of women who've been raped, and they don't even bother to report cases because when they go to police stations, they're ridiculed. Like some people will say when they go to hospitals, they're treated badly, they're discriminated against. I think that's one thing that also has to change. So, and what is your message to women and men? Because breast cancer also affects men. This month.
Not only does it affect men, I think for me, we need to, as women, look at men as our doctors at home to say, can you check my breast? Can you notice the difference if there's any change? Let's call on women to say, let's be in partnership in responding to this, because men need to be educated. I found that when we go to the rural areas, you'll be shocked that when a woman stands up and says, I discovered that my breast was affected by breast cancer, and my husband told me that when he paid lobola and those cows were for a woman with both breasts, and now that I'm going to lose one breast, he's done with me.
Ignorance and insensitivity.
I know it sounds absurd, but that's what we've come across when you go to the rural areas, and it was important therefore to educate everyone, and ensure also that, because one of the risk factors is smoking, to ensure that men are empowered with the knowledge to say, don't smoke in the presence of your family, because you're exposing them. If they're secondary smokers, they then are more at risk, of getting these cancers. So we educate men as well and women, and empower them with knowledge on how to respond. Because one thing is that becomes difficult, that when you get hit by this, you don't know what to do. And also for me, what is we've been lobbying for is the reduction of the cost of medicines for life-saving medicines. We're no longer talking about the medicines that are going to prolong your life, but we're looking for medicines that are going to save the lives of our people, and also lobbying for ensuring that these medicines are produced here in our country. There's no reason why we shouldn't. We should go outside of the country and pay, exorbitant fees, because for me it has changed from life-saving to profit-making, putting profits before the lives of our people. Because you'll be shocked when I tell you that for one woman to be treated for breast cancer, it would cost 250,000 per person in a public healthcare setting, and when you go private, it's double the amount. And I don't think that is acceptable, and I think our government needs to do a lot to ensure that they force these pharmaceutical companies to bring down the cost of medication, and also to look and zoom into the medical aids, because you'll be shocked that there are people who only discover when they are sick and diagnosed with this disease that there's an exclusion basically clause to say that we cannot cover this type of medication. And I think for me, this is what our government should look out for, to ensure that our people are protected, those that are fortunate to be in medical aids, but also in public healthcare settings. Our women need to have access to treatment, life-saving and quality drugs.
Such a pleasure having you in our studio, Tobeka Madiba Zuma, former First Lady on the Glanzito Super Drive. Good having you.
Thank you so much. Thank you for having me.
Don't be surprised, ma bacela ukuthatha ama-selfie nawe.